Welcome back. March is Colon Cancer Awareness Month, so today we're going to tell you if you should be screened for it and what puts you at risk for developing this type of cancer.
That's right. Doctors Ted Kane and James Quiet are here from GI Associates to tell you the causes of colorectal cancer and what you can do to prevent it. Thanks for being here, guys.
Yeah, we really appreciate
Thanks
it.
for having us.
Yeah. You know, it's one of those conversations that I think people are always hesitant to have, whether it's with a doctor, among friends, family, but it's kind of gets a little bit of a bad rap because people get nervous about talking about colonoscopies.
You just leave it to children.
I know.
Children will break the barrier.
3, 4, 5-year-olds, they are fine with it. What is colorectal cancer?
So colon cancer is cancer of the large intestine, and it's a completely preventable cancer. It starts off with what's called a colon polyp, which is a very small growth that eventually grows into a cancer, usually over a 5 to 10 year period of time. And if we do colonoscopies and remove those polyps, we can actually prevent the cancer from ever happening.
So what are the guidelines of getting a screening?
Well, if you have no family history, what we consider an average risk person, or no other long-term bowel issues like inflammatory bowel disease, we're recommending that people get started at age 50. If you have a significant family history of colon cancer, or if you have other bowel issues, we started earlier with a family history, usually starting at age 40.
Okay. What causes it? If it's not a genetic component, what can cause colon cancer?
Well, there is believed to be a mutation that goes on in the lining of the colon. And people who have a family history are probably more likely to develop that mutation. But just growing older, you're at risk for colon cancer. If you live long enough, you're probably going to develop polyps. That doesn't mean you're going to necessarily get cancer. But
is there a way to prevent it?
Yes, so obviously things like not smoking, healthy high-fiber diet, as we talked about on the last segment, and getting a colonoscopy is recommended, is really the biggest thing you can do to prevent colon cancer.
Are there symptoms outside of the polyps that people can be aware of?
Most people with colon cancer don't have any symptoms, which is why it's so encouraged to get screened. Some issues with change in bowel habits or actually passing blood when you go to the bathroom are what we consider alarm symptoms, and those are people who really need to talk to their doctor about those things to consider a colonoscopy, maybe even earlier than 50 if you have those problems.
So don't ignore those changes in habits.
Absolutely.
Even if you think it might just be eating beets, you should still go, right?
Exactly.
And so one of the things we said at the beginning is it is preventable and beatable. If you get an early detection, what does it look like? What is your prognosis?
Well, if you catch a cancer in the early stage, you have a very good chance for a cure, and the 5-year survival rate is very high. It's unfortunately for the patients who wait or are diagnosed with a late stage from the beginning that have a much worse prognosis. So the key is to catch it early, but really the goal is to catch it before it even becomes cancer, and that's removing the polyps.
So this would have been somebody like Katie Couric's husband, who it was late stage cancer, meaning it had spread already past just the colon.
That's correct. And some of the issues, Katie Couric has done a great thing bringing a lot of attention to the cause of getting colonoscopy, and I know she even televised her colonoscopy, which I think is a great thing because the idea of a colonoscopy does sound a little bit uncomfortable, but I think she kind of showed that, in the right setting, the right environment, with a good doctor, it really isn't that bad of an experience, and having that weight off your shoulders to know that you don't have a problem is really an important thing.
Is it different for men and women?
No, colon cancer is risky for both men and for women. As far as cancer deaths, colon cancer is number 3 in cancer deaths for women as well as for men.
Wow.
So the procedure itself, the colonoscopy, you do, I don't know that much about it, I'm just remembering what little I know about it. So the bowel prep, but do you get an anesthesia or anything to make you comfortable?
Yes. Well, first of all, the bowel preps, that's been our biggest issue for most patients. But in the last several years, we've been developed newer bowel preps that are lower volume, much more tolerable to take. So we've really helped in that aspect. As far as the colonoscopy itself, we do sedate people, and depending on their level of say, medications that they might be on will depend on what kind of sedation we use. So, some patients still will be able to, or need, I'm sorry, anesthesia, an anesthesiologist. But the vast majority of the patients we sedate with our nurses, and they're very comfortable, and they don't really remember much at all.
Does insurance cover colonoscopies?
Yes, so Medicare does cover colonoscopies, and under the Affordable Care Act, colonoscopy is covered as a screening examination under all the new insurance plans.
So that's
great.
a new thing, that you can go get it, generally, right?
In general, I mean, a lot of insurance plans previously did cover it, but with the legislation, it has been sought after as a very important test and a very proven test, which is why the insurance covers it. Truthfully, the insurance would rather pay for your colonoscopy than unfortunately pay for cancer treatments.
Right. Sad. But I know you got to go in, you got to get those tests, be smart about it, get checked, and go to a professional. So I'm going to make sure everybody knows where to go to find the GI Associates. There's 14 locations. You can go online to find all of them and the one closest to you at WIGIA.com for more information. Thanks, you guys.
Thanks for having
Important
us.
conversation. Appreciate it.
Thank you.
Thank you.
Okay.